Mr. Whitaker and Futile Treatments by Katie McCaffrey, Xander Sisko, and Melanie Voller.
Mr. Whitaker, a 94-year-old man who suffers from congestive heart failure and advanced Alzheimer's, has been in and out of the hospital for several years. After severely fracturing his ankle, he was confined to a wheelchair and was told he might not be able to walk again. His family cannot care for him, so they hired a 24-hour aide to help him. Mr. Whitaker still recognizes his family, but can only have basic conversations. After experiencing breathing problems while using oxygen, he was placed on a ventilator and does not appear to be conscious. Dr. Smith, who hasn't treated Mr. Whitaker before, thinks he only has a couple weeks left to live and believes that doing a tracheostomy and inserting a PEG tube would be futile. Miss Whitaker and their children insist on doing the treatments. We are arguing that the patient and his family have the right to the treatments they are requesting, and Dr. Smith, as Mr. Whitaker's physician, has an obligation to respect their wishes. As society strays further from paternalistic practices, doctors are starting to lose power when deciding treatment options for patients. As this decreases, patients gain more power to decide the fate of both themselves and their loved ones. Doctors should be able to understand and respect the wishes of their patients, rather than act on their own accord based on their own clinical diagnoses. Since the medical world is being increasingly digitalized, patients have more access to information online and could possibly find alternative treatments. The resident for Dr. Smith suggests doing a tracheostomy and inserting a PEG tube for long-term care. But since he is uncomfortable with doing this, he ignores the patient's wishes to move forward with this treatment. This leads to the next argument, respect for patient autonomy.
Autonomy is a key reason why doctor-patient relationships work. The patient trusts that the doctor will do treatments that have been consented to. Patients also trust that doctors will not perform unnecessary tests and treatments. This relationship is expected to continue even when the patient does not have decision-making capacity, such as being sedated and intubated. In these cases, the patient assumes that choosing treatments and consent to perform them will fall to their medical proxy. In Mr. Whitaker's case, his medical proxy would be his wife. She is familiar with treatments he has consented to before and also knows what type of treatment he would want if unable to consent. By overriding Mrs. Whitaker's ability to choose a treatment for her husband, the doctor is ultimately taking away Mr. Whitaker's autonomy. This type of response by Mr. Whitaker's doctor creates mistrust in an environment that can't survive without it. This mistrust is also heightened for the Whitaker family since their chosen treatment, a tracheostomy and PEG tube, were suggested by one of the doctors working on their case. The American Medical Association lists several rights that patients have. One of these rights is the ability to make decisions based on physician recommendations. By not allowing the Whitaker family to place a tracheostomy and PEG tube, as suggested by a resident on the case, the hospital is infringing upon this right. Another right the patient has is centered around discussion of appropriate treatments with their benefits and risks. By not informing the Whitaker family of the possibility of placing a tracheostomy and PEG tube, the main doctor in the case, Dr. Smith, is not respecting this right and instead is making a decision solely on what he believes. Finally, the Whitaker family has a right to obtain a second opinion. Dr. Smith also infringes on this right by informing the family that Mr. Whitaker will most likely die within 2 weeks and never leave the hospital. Dr. Smith, who is new to the case, never acknowledges that other doctors may prescribe a different treatment plan. Throughout life, it isn't uncommon to hear of doctors getting a diagnosis wrong. A lump ends up being benign. Suspected tuberculosis is just pneumonia, or that joint pain is actually broken bone. This misdiagnosis often occurs even when the doctor knows the patient is very familiar with their case and medical history. When a doctor is new on a case, we see more time taken to receive a diagnosis and more mistakes than a doctor with a long-term relationship with the patient. In Mr. Whitaker's case, he had a new doctor who gave him less than 2 weeks to live regardless of what treatment was tried. This new doctor saw an old man on a ventilator and made an educated guess on how his life should end. This doctor didn't try to wean Mr. Whitaker off the ventilator to see if his condition would improve, or even think about placing a tracheostomy to allow him to die peacefully at home. However, time left to live should not actively influence treatment. The time given to live is almost never correct. Patients often live months or years longer than a doctor predicts. By not treating Mr. Whitaker properly because he only has 2 weeks left to live, this new doctor is compromising Mr. Whitaker's standard of life. Age should not dictate the type of care and treatment you receive.
There are a couple of reasons as to why some would argue that Dr. Smith should be allowed to withhold treatment he deems futile. The two reasons I am going to present and refute are that physicians can conscientiously object to certain treatments and that providing futile treatments is a waste of time, money, and other medical resources. As mentioned earlier, one reason why some might argue that Dr. Smith does not have to comply with the family's wish for more aggressive treatment is that he conscientiously objects to providing futile treatment. According to Bernard Lowe, conscientious objection allows physicians to refuse care for a patient due to unacceptable threat to their personal safety, their personal moral objections to providing care, or a counterproductive or adversarial doctor-patient relationship. In the case of Mr. Whitaker, Dr. Smith has a moral objection to providing aggressive treatment because he believes Mr. Whitaker will die regardless of if he receives or does not receive this additional treatment. Dr. Smith does not want to inflict pain and potentially dangerous treatment on a man who he believes is already going to die in a few short weeks. By following the family's request and inserting the tracheostomy and PEG tube, Dr. Smith is being forced to act in a way that goes against his conscience. Since Dr. Smith has a moral objection and is a free, autonomous agent, he should be able to freely reject performing the futile treatments. However, having a moral objection to providing more excessive treatment does not completely free Dr. Smith of providing Mr. Whitaker with treatment. The Texas Advance Directive Act outlines a set of rules to resolve conflicts of futility between family members and physicians in Texas. After having an ethics consultation, if the conflict is still not resolved, the family is allowed to arrange transfer of the patient to another physician or institution willing to give the treatment requested by the family. During this time, the physicians are required to provide the requested treatment. Only after enough time has been granted to find new accommodations, the physician may unilaterally withhold or withdraw therapy that has been determined to be futile. If Mr. Whitaker's case occurred in Texas, the physician and family should follow the procedures by obtaining an ethics consultation. If the ethics committee agrees with Dr. Smith, then he and the hospital must allow the family time to find either a new physician or facility, while in the meantime providing Mr. Whitaker with the tracheostomy and PEG tube. By finding a facility or physician that is willing to provide the treatment, both the family's request will be taken care of, while Dr. Smith does not have to violate his moral code. A second possible objection to providing Mr. Whitaker with potentially futile treatment is that it could be using up unnecessary resources and cost too much money. Operatings have to be used, surgeons and other medical professionals require payment, drugs must be given, medical supplies have to be bought. All of these costs add up to make a potentially worthless treatment very costly. Additionally, patients could be using resources that other patients could need. Right now, we are facing a problem of scarce medical resources. If a futile treatment takes vital resources away from another patient who would actually benefit from that resource, then there is a big problem. In Mr. Whitaker's case, Dr. Smith would rather invest his time and patients' money into palliative care rather than spend that time and money on a tracheostomy and PEG tube. However, money and resources should not be the guiding principle when determining a care plan. Medical decisions have to be made with the patient's best interest in mind. Therefore, cost should not be a factor in treatment decisions, because if cost is taken into consideration, then the patient is no longer the priority. The values of the patient and their desired life should outweigh the factor of money. Additionally, Other cheap but futile treatments are still provided without hesitation by physicians. One author describes a scenario where a patient believes that a daily multivitamin pill will cure him. If physicians allow this treatment to be given, but not a more costly treatment like a tracheostomy, then physicians are allowing cost to dictate treatment plans. If treatment were merely futile but not painful or costly, it might simply be provided. For Mr. Whitaker, money is not a concern that has been mentioned. Therefore, the physician in the hospital cannot use that as an excuse for why Mr. Whitaker cannot receive the tracheostomy and PEG tube.
In conclusion, Mr. Whitaker and his family have the right to obtain a tracheostomy and PEG tube, even if Dr. Smith believes those treatments to be futile. This is due to society's stray from paternalism, where the doctor is the one who decides any and all treatments the patient can receive, autonomy, in which the American Medical Association states that patients have the right to choose which treatments they receive, and the fact that diagnoses are not always correct.